Okay. What is the most likely diagnosis? Basal cell carcinoma, dysplastic nevus, melanocytic nevus, seborrheic keratosis, or squamous cell carcinoma? Okay. A 28-year-old male woman presents to the dermatology clinic for evaluation of a mole on her left arm. The mole has been present for many years without significant change in size, shape, or color. On examination, the mole is well circumscribed, 5.5 centimeters in diameter, and uniformly tan. A biopsy is performed, which reveals nests of nevus cells at the dermoepidermal junction. Which of the following is the what is the most likely diagnosis? Okay, just from based off of what I have here, there is no imaging, there is no labs. My gut is it's just a regular mole. Um, and so I would get rid of any cancer right now. I would say no squamous cell, no basal cell carcinoma. My gut would be a melanocytic nevus. This does not, to me, tell seborrheic keratoses. And dysplastic means that it's progressing to. It's not yet have reached cancer, but it's progressing to cancer. Um, so I would say melanocytic nevus, and I would probably keep that.
Okay, perfect. Okay, you worked through that case beautifully, or that question beautifully. Okay. Uh
Great.
Give you some props here, right? I liked how, you went through all five steps, right? I also want you to kind of, when you're working through these questions, you're thinking of it very, very kind of logically and a very flow chart way is usually how I say it, right?
Okay.
So, a couple things that you're saying, right, that you've noticed, right? And I'm going to just verbalize, right? But it's well circumscribed, right? It's only zero point 0.5 centimeters in diameter and uniformly tan. So these are all things that in my mind, right, clinically is benign, right? So talking about benign versus malignant. So give me kind of what are some characteristics of a mole that is malignant in character, since you know the benign, you must know the malignant, right?
So the malignant, you would have very in terms of like moles. Do you mean just in general or in terms of moles?
Yeah, in terms of moles, I would say, right? Like
So
for instance,
yeah,
yeah.
it's like the ABCDE. What's the A? Is like abnormal. I forget.
Yeah. So
Abnormal. I think shape or the
yeah,
borders. So borders are off. Color is differing between them. The diameter is large, and then I forget what E stands for as well.
yeah,
Uh,
evoluting, right? Or evolution, right? So it's
yes.
evolving, right? So yeah, so all those things that you're mentioning, your ABD, CDEs, right? It's abnormal, right? In shape, right? Borders are irregular, colors is abnormal, it has multiple different colors, diameter is bigger. They always used to say bigger than a, pencil eraser size, which none of us uses pencils anymore, but definitely bigger than zero point 0.5 centimeters, that's for sure. And then evolving or evolution, meaning that it's growing in size. That's never good when you're talking about a mole or anything, right? Because you're worried about malignancy. So definitely for sure you recognize that's a benign. So even recognizing something benign versus malignant here is going to give you a leg up, right? And so you can get rid of this, right? Get rid of this, right? But also you also kind of worked out dysplastic. Dysplastics means, has a potential of malignant characters, right? But this one doesn't have any of the A, B, C, D, E, so you're not worried about that, right? And then,
Mhm.
right, you're down to melanocytic nevus, right, versus seborrheic keratosis, right? But this is just a regular mole, right? Even
Yes.
on biopsy too. So remember, biopsy is going to be your most specific, right? So I want you to remember that for future questions. If they ever give you a biopsy, make sure you kind of take a look at it and kind of think to your mind, is this benign or malignant, right? Because if the characteristics, right, like the physical exam is benign, right? But if the biopsy shows that it's malignant, meaning that it has high mitotic figures, it's past the basement membrane, right? The cells look really nasty, then you know it's malignant. Does it make sense?
Yes, it makes
Yeah,
sense.
because biopsy is going to trump everything. But, the biopsy here, lucky for the patient, right? I always call these questions as patients because if you treat them like patients, it's harder to miss. But yeah, the biopsy showed kind of a benign characteristic. So, it's benign. So, C is going to be your answer. But like I
Great.
said, you worked through this question beautifully. There's nothing I would change.
So when you're going through questions like after again like a 40 block, a regular 40 block, and you get the
Sure.
question right, you kind of avoid the third part of misconceptions, right?
Yeah, to be honest with you, I would say that if you get a question right, unless, right, there's always exceptions to everything in medicine, even when when learning. But I usually say don't worry about reviewing the questions that you got right, right? Because, obviously you're going to
You got it
learn
right.
the most from the questions that you get wrong. So there's no point in kind of reviewing what you got right. The only time I would say, is that if you felt like the question that you got right was completely just randomly guess and you got lucky, then sure, you can add that to the list of things to review. But the main things I want you to kind of focus on are really more of the questions that you got wrong than right.
Okay, makes sense.
Okay.